A patient with cirrhosis and hepatorenal syndrome develops shock. What's the paradoxical renal physiology? A. High renal blood flow, low GFR. B. Low renal blood flow, high GFR. C. High renal blood flow, high GFR. D. Low renal blood flow, low GFR. E. Normal renal blood flow, low GFR. Answer: A. High renal blood flow, low GFR. In cardiogenic shock, what makes right ventricular RV failure particularly dangerous? A. RV is more susceptible to ischemia. B. RV failure causes a vicious preload-afterload mismatch. C. RV dysfunction impairs left ventricular filling. D. B and C. E. All of the above. Answer: D, B and C. A patient with systemic sclerosis, scleroderma, develops shock. Which feature best explains the physiology? A. Cardiac tamponade from pericardial fibrosis. B. Distributive shock from autonomic neuropathy. C. Right heart failure from pulmonary hypertension. D. Cardiogenic shock from myocardial fibrosis. E. Hypovolemic shock from GI blood loss. Answer: C. Right heart failure from pulmonary hypertension. In shock, what's the significance of LPS-CD14-TLR4 interaction? A. It's how the body detects hypovolemia. B. It triggers cardiogenic cytokine release. C. It's the initial step in septic shock cascade. D. It causes distributive shock in trauma. E. It leads to obstructive shock in ARDS. Answer: C. It's the initial step in septic shock cascade. A patient with thoracic aortic dissection develops shock. Beyond simple obstruction, what's happening? A. Cardiogenic shock from acute aortic regurgitation. B. Hypovolemic shock from occult bleeding. C. Distributive shock from massive baroreceptor failure. D. Neurogenic shock from spinal cord ischemia. E. All can occur. Answer: E. All can occur. In dengue shock syndrome, what unique coagulation issue worsens the shock state? A. DIC causing obstructive shock. B. Factor deficiency leading to hypovolemia. C. Platelet dysfunction causing distributive shock. D. Capillary leak from altered glycocalyx. E. Antibody-mediated platelet clumping. Answer: D. Capillary leak from altered glycocalyx. A patient with Takotsubo cardiomyopathy is in shock. What's the catecholamine paradox? A. High epinephrine worsens contractility. B. Norepinephrine improves function. C. Dopamine causes further ballooning. D, A and C. E. All of the above. Answer: D, A and C. In traumatic shock, what's the significance of the endotheliopathy of trauma? A. It mimics DIC but isn't consumption-driven. B. It causes a distributive component in hemorrhagic shock. C. High syndecan-1 levels mark its severity. D. All of the above. E. None of the above. Answer: D. All of the above. In a patient with shock, high EVLW but normal PAOP suggests what? A. Cardiogenic shock. B. Obstructive shock from PE. C. Non-cardiogenic pulmonary edema. D. Hypovolemic shock. E. Can't determine without more data. Answer: C. Non-cardiogenic pulmonary edema. In septic shock, what's the immunosuppressive paradox? A. High cortisol causing lymphopenia. B. Hyperinflammation followed by profound immunosuppression. C. Complement activation impairing phagocytosis. D. Catecholamines downregulating NK cells. E. All contribute. Answer: E. All contribute.